Thank you. Our next speaker is widely known as the consultant's consultant, a convergence scientist with expertise in healthcare, informatics, and innovation. He has worked extensively across the Asia Pacific and Middle East. With a career that spans both MNCs and startups, he has successfully transitioned from IT to health informatics and pioneered clinical information solutions at Sing Health. He holds a doctorate in health informatics and four master's degrees in data science, computing, public health, and business administration. He is an expert advisor for the World Health Organization, a visiting scientist at Singapore General Hospital, and a published author. Today, he will speak on empowering nursing practice through digital transformation. Ladies and gentlemen, please join me in welcoming Dr. Adam Chee.
Hello, Dr. Adam. Good afternoon.
Hi, hello from Singapore. Um, what I'm gonna do is let me share my slides first. Right. So again, I think it's afternoon over at your side. So very good afternoon to all of you. My name is Adam, and I am calling in from Singapore. So just a little bit of trivia. I used to work in Dubai, Abu Dhabi, as well as the Kingdom of Saudi Arabia. I had to come back to my own country due to COVID, and here I am now. So today, I am going to share with the conference a little bit about digital transformation with a nursing perspective. And these are some of the objectives. What we will aim to do is to talk a little bit about the challenges, which I believe has already been well covered by the previous speaker. We'll also look into some of the digital solutions. Now, due to the limitations of time, I will cover this very quickly. They are not exactly a secret. All this information can be found very much open off the internet. What I'll try to do is to put it into context from a nursing perspective, and then we can have a discussion from there. So current challenges. This may be less of an issue in let's say the kingdom. I'm not sure about Kuwait, haven't been there. But in a lot of places where I have done projects, which covers a wide spectrum of countries in Asia and the Pacific, we usually have an issue with patient load. And this is very true in Singapore as well. So we have very high turnover rate. So just to give a background, in Singapore, we have 4 nursing schools. And the country is actually very small. Now, 4 nursing schools producing a lot of nurses every year. And we hire a lot of nurses from the Philippines, India. We recruit a lot of nurses elsewhere as well. But every year we still face a shortage because of the high patient ratio. So a lot of our nurses, after they gain experience, including foreign nurses, they'll leave for countries like Australia, the United Kingdom, or and many come to the Middle East as well, due to the more reasonable patient ratios. So that is a very big problem in many parts of Asia. We also have an issue of long shifts, extended working hours. So this actually attribute to physical and mental exhaustion, especially if we have the nurse standing for long periods throughout the day. So that is an issue that we're trying to resolve as well. And it can get very busy where we have a high patient load, a shortage of nurses. And this brings us to the next point, emotional stress. So while the problem may not be as bad as medical social workers, we do have a situation where the nurses, especially for the younger ones, they will have to deal with emotional and trauma caused by life and death situation. Now, it does get to you. It can get depressing, especially if that's the only thing you do on a day-to-day basis. Again, add on to long shifts and high patient ratios. So these are some of the challenges that we have in terms of workload and burnout. Now, this was also mentioned earlier. We have the same issue over in many parts in Asia as well, administrative burden. In addition to expecting our nurses to provide nursing care, not only to the patients, but sometimes emotional support to the family members as well. There's also a lot of administrative duties that includes documentation, which are important for patient safety and quality of care. But what we do not factor in is time for nurses to actually undertake such activities. So one of the common issues we have is we try to put nurses who are administrating medication with a vest, so we give them the ladies a vest and saying not to disturb the nurse while they are dispensing medication. But this actually doesn't help because the nature of a nurse is that they attend to the patients for their needs. And patients don't understand that they're not supposed to disturb nurses. So this is an example where we don't really cater to the workflow of the nurses very well. And we don't cater interruptions very well as well. So imagine a situation where you're busy providing care. At the same time, you're supposed to document quite a fair bit of stuff, and you're getting interrupted on a constant basis. So that add on to the mental stress as mentioned, in addition to all this documentation, ensuring with compliance, and then one other equally problematic area is coordination. A lot of times we depend on the nurses to help ensure that the wards are operating smoothly. They're the one passing messages, but this is the last of their concern because nurses are actually a lot of time trying to make sure that patients' needs are attended to, in above and addition to all these workload and administrative burdens. So these are some of the challenges that we face and we're trying to address using technology. Now, when it comes to implementing technology, which we'll come a little bit more to later, we try to bridge the gap. Now, this is common practices. We're not going to judge whether they work or not, but most of the time when we introduce solutions, we will then provide training on how to actually use specific applications and devices. Of course, we also try to upgrade knowledge of nurses, including professional development. So similar to many countries in Western Hemisphere, we have specialization tracks for nurses when it comes to informatics. But the question is always adoption and uptake. While they are interested nurses, uh, and we do provide specific pathways, they are not necessarily recognized and translated into incentives. Because if a nurse would choose to specialize in a clinical discipline, it usually translates to better opportunities and better pay, because these would be skills that you can actually deploy and use, and they're visible. So your contributions and impact are visible. Whereas if a nurse chooses to be specializing in nursing informatics, while the work is important, it is time consuming, it's done behind the scenes, and you don't necessarily attribute the success to the nurses. Sometimes you think that, oh, maybe the IT department is the one who has done a good job, whereas nurses would have played a huge role in ensuring that any solutions that has nurses input are taken care of, well designed, adhering to terminologies, procedures, etc. So this is not necessarily visible, if you will. So some of the common solutions you will find for nurses deployed for the nurses' day-to-day activities. But before that, I'd like to clarify on the term of digital transformation. What I've noticed in many of my projects around the globe is that people tend to think of digital transformation as a technology endeavor. So that when you say, "Oh, I'm dealing with digital transformation," the first impression is you must be from IT. This can be confusing because there are two distinctive concepts. So I'll try to demystify this a little bit for this particular session. Now, when we talk about digital transformation, this could be when you go for a conference, when you look at literature of the internet, when you look at journals. There are two other terms that comes up on a regular basis. The first term is digitization, and the second term is digitalization. And these two terms are frequently used as synonyms for digital transformation. So one may then go away thinking that, oh, digitization, digitalization, and digital transformation are referring to the same thing. But in reality, they are not. So let us start with digitization. This really refers to using technology. It is the process of changing from an analog form to a digital form. So the most simplistic example would be going from paper to computers or a tablet. So just using technology. Whereas for digitalization, we define it as the process of moving or changing how you do things using technology. So you actually have to optimize your current processes and workflow. So if you were to revisit digitization, you can think of it as tools. These are really just tools. So when do we classify it as digitization? Well, if you see a project being implemented and the primary contributor are technology that you bought, these are things that you can buy with money, and you can implement them straight away. This is digitization. So in the effort to do digital transformation, you will need infrastructure, you will need a new computer, servers, etc., and you purchase such equipment. These are really just digitization. What you need to move on, in addition, is to ensure there's a strategy and operations on how to best utilize such technology. This means changing the way you approach how you do things. So these are two interrelated concepts, but they're not exactly the same. So one are tools, the other one refers to the way you actually approach how you would execute a certain task. Now, both are just as important because without technology, you would not be able to do digitalization. You have to optimize your workflow and processes using technology to enhance whatever you're doing. However, these two terms still do not define digital transformation. So what I'll do is I will give an example by using the traditional thermometer. So how the traditional thermometer works is basically really fundamental physics. There's mercury in the thermometer, and upon contact to higher temperature, the mercury will expand, and at a lower temperature, the mercury will contract. So if you use the traditional mercury, which is not safe because number one, it's tube in a glass casing, that you can actually break it and cause more harm. And second, mercury is actually poisonous. So we don't really want to use the traditional mercury thermometer anymore. That's the analog form. We're going to go and use a digital version. So this is just replacing the tools. This is just using technology. And you can notice from here, there is not much changes on how you will approach the acquisition of temperature. The workflow, the processes remains pretty much the same. You just change the form factor. And the digital thermometer would not be anything too fancy. These are just technology you can buy off the internet, nothing fancy. So if you were to move to digitalization, this is where we will change the way we approach temperature taking for this particular example using technology. So my example here has a baby, but you can really replace this with any patient where you are required not to have close contact with. So this could be a burn patient. This could be a COVID patient. or just could be just a patient who wants sleep. They just need to sleep, and you don't really want to wake up the patient every few hours just to take the temperature. It's not very patient-centered, if you will. So in this case, technology comes in, and there's a change of how you acquire the temperature. So if you notice, there's a patch that is put on to the baby, in this case the patient, and there's a device that acquires the data pertaining to the temperature on a continuous basis. Of course, there'll be some use of artificial intelligence. This is where if you have baseline data, once there's a spike, and coupled with, of course, all your prior data with the patient, you're able to determine that, hey, patient is actually going to get a temperature. This is where you alert the nurse to come to the patient. So you notice there's a change in the way you approach temperature taking, not just purely digital thermometer, but instead of being disturbed, or rather instead of being scheduled to approach the patient every hour or so to take the temperature, and this will disturb the patient because patient needs to rest. And again, we talk about the workload. Nurses are busy. They get interrupted all the time, and coupled with such routine duties, they can get very stressed. So this actually fundamentally changed the way nurses will approach temperature taking. But here's the thing: nurses handle a lot of duties. Temperature taking is merely one of them. So when it comes to digitalization, we're just addressing a specific area, but it is not enough. So if you were to translate this scenario back to your hospital environment, you realize that a lot of times when there are technology projects, there are the so-called digital transformation projects, the hospitals may have done it only in one particular segment and not the entire continuum of care. Or if you want to actually scope down later, not the entire service line. This actually adds some more stress because nurses or even medical doctors or paramedical staff now have to use two sets of systems, the electronic one and the paper one, or two separate electronic systems. So this isn't very good. It's great, but we can do better. So this is where we want to go into digital transformation. We want to use technology and modify uh, processes and optimize it on a system level process where we rethink, where we redevelop how we approach the delivery of healthcare services from a persona basis. So effective deployment of nursing informatics in this case will include multiple aspects, not just temperature taking. So if I were to go back to the concepts earlier on, digitization and digitalization, this is where you have optimization of processes. And you find this very commonly seen in hospitals where you have Lean Six Sigma projects. This is towards this spectrum. And if you move towards the right side, when we approach the transformation, this is where we optimize the human experiences and the systems interaction aspects of things. So this is where we deploy frameworks like design thinking, systems thinking, to implement and effect whole level shifts. Of course, this is a little bit more difficult. This is where you get health informaticians to come in and help you re-architect sort of this clinical workflow. So with that in mind, let us then approach looking at digital solutions in nursing. Of course, key to the game will be your electronic health records. Nurses use a lot of this, not only to access data. So you need data to provide you with updated insights, so you can provide care to the patient. But at the same time, nurses input data so that the rest of the healthcare professionals will be able to get insights that's obtained from nurses during the administrations of care, so for their care delivery services as well. So this is something that is important, although not necessarily designed well for nurses because it doesn't capture context. And this is what a lot of electronic health records company are trying to improve. But it is one of the key pieces that we have when it comes to nursing informatics. There's also telehealth and remote monitoring services. Now, a lot of the chronic care that is provided by healthcare professionals can be done by nurses. So a lot of countries, including Singapore, we have advanced practice nurses who attain qualification, and they can actually start to provide consultation to patients. And we have moved further up the line for a few of our care settings where we have remote consultations with nurses, especially for chronic disease management. This has been wildly popular because the nurses who have achieved the competency and knowledge and passed the examinations have demonstrated that they can do just a good job as physicians. And because we can upscale this, we can increase the pool of specialists. And in addition to that, we couple with controlled telehealth services. This actually enables the population that we're trying to serve to have more flexible options, especially for the elderly, where it's not so convenient for them to leave their homes, or sometimes even working adults, where they just need to get regular consultation pertaining to chronic disease. So these are two main areas. There are more, definitely for mobile health applications as well. So a lot of places, again, including Singapore, we do deploy nurses for home visits. So one of the key technology would be their mobile health applications, where it actually facilitate the access of patient information of the hospital's electronic health record, or even through Singapore's national electronic health record. And then the nurses and sometimes the physicians together, they'll be able to obtain necessary information pertaining to the patient and then provide the clinical care as well as updating whatever new medication, new needs, or equipment that is needed. So this has proved to be very useful for home visits. And of course, behind all this, because we're acquiring a lot of data, and thanks to the quality of the data being captured, we're able to actually utilize predictive analytics. So how have we utilized it? We can actually, these days, already start to do trending on how well patients are responding to their medication. And couple this with home visits, our nurses can then look at the social determinants of health, all these factors influencing patients' care. And this, again, will be good data that can be captured there to fit into the model. And there are also some administrative duty that we are trying to use artificial intelligence to help free up work. So there are clinical care plans and routine protocols that are put in place and automated. So the moment certain triggers are made, the relatively follow-up sessions, the medication prompts, the alerts, the advisory will come up. So this will actually reduce the stress level that is put on to health professionals, including nurses, of course, and reduce the amount of paper that we actually have to bring around showing it to the patients. Because one thing we realize is a lot of times, especially if we are dealing with elderly, they themselves are not necessarily, although they are the recipients of care, they are not necessarily the one who's organizing their care schedule. It will be either the caregiver or the children who are very technology savvy. So through the use of mobile apps is actually a better option, and of course much more sustainable from an economic environmental perspective. This has been discussed earlier on. So robots and
I just would like to
automation.
remind you of time.
So one interesting about robots and automation, and I see this not very common in a lot of countries, is that in Singapore, because manpower is very expensive, we're a small country, we don't have very much resources, so manpower is very expensive. So this is where when we deploy robots, again we have nurses leaving the workforce due to turnover. So we can't really generate enough nurses. In addition to them being expensive, robots actually make sense for us because we save money. So it's also widely implemented in Singapore. But as articulated by the previous speaker, they are not replacing nurses. They are really just a tool to help enable nurses to do their job better. So they are really just, you think of it as there's no difference between this and a computer, just extending nurses' impact. So let me share with you some success stories. I removed sensitive data, but research has shown that by using electronic medical records, we do achieve efficiency. So there are studies where we realize that we can save up to 30% in terms of documentation time. Now, I do understand this is not universal, so the catch is implementing a solution well, and this would take experience and some patience. Telehealth adoption, as I mentioned earlier on, definitely time saver, efficiency saver as well, because we have situations where, let's say, patients is due for a visit at 9 a.m. That means they actually have to leave their home at 8 a.m. So they may wake up late, they may get into a traffic jam, or they may be raining that day, and then they decide, well, I'm not going to go today. I'm just going to give it a miss. And they try to reschedule their appointment, and maybe they're given 2 months waiting time. And then they decide, hey, you know what? I'm responding well to medication. I'm just going to give this regular checkup a miss. So with telemedicine solutions, we actually mitigate a lot of these. And this has reduced not only waiting time, but also cross-infection. So if you, as you might be aware, being in the waiting area in the hospital is one of the best way to catch a germ disease. So it's best try not to be there if you're not feeling well. Of course, mobile apps, as I've mentioned earlier on, this has also demonstrated many benefits. So from a patient end, timely reminders with visual aid has helped the patients uptake the medical consumption. So they don't, not only do they not forget, but they get reminded on the proper instructions. This has proven many times to be more effective than a verbal update or even a reminder, because people do forget about the instructions. And of course, artificial intelligence.
Sorry to interrupt you, doctor. We have 2 more minutes remaining.
Sure, sure. So of course, implementation strategies, I'll just quickly go through them. We've mentioned education and training. This is important, but what is equally important would be the change management. And it is important to tie both together. From experience, providing training and education gets people started. But reinforcement on a regular basis as well as support keep people sustained and motivated. And so these are two very important elements that must be taken in tandem. Unfortunately, what I've seen in most implementations, we will have very strong training and education, and then very top-down change management in the beginning. But towards the end, the support and the reinforcement is not necessarily as good, and this will lead to burnout due to the various factors that we have discussed earlier on. And of course, collaboration. Don't expect the nurses to do everything. We have this interesting phenomena in Singapore. Nowadays, it's lesser, but we did have it for a period of time where we empowered nurses to do informatics. We had a situation where other nurses approached these informatics nurses for IT problems, which actually further add on to stress because this is above their duties. And we have since took steps to mitigate that, to explain that informatics is different from IT. So we have to have proper empowerment and stakeholders engagement to make sure people understand that this is an interdisciplinary effort. So yes, you might be using a computer, it might not be working well, but if it's an IT equipment issue, a login issue, your password expired, you should be looking for IT and not the nurse. And of course, when you start to implement solutions, don't go big bang. Always go small scale. You'd be surprised that whatever you started off trying to do, with as you move on to your solution design and implementation, it will almost always change because people get exposed to possibilities and then they make new requests. So always go for a small scale implementation first and then iterate along the way. Let me just quickly go through some future trends and that we see. So virtual reality is coming. Um, yeah, just 2 days ago, I think Meta released a new version of the augmented reality, and this has proved to be very useful. It's not what we have traditionally seen, so I encourage everyone to check it out. So using virtual reality, if implemented properly, and we've done some in Singapore, not to the best of effort yet. So we're going to try to improve there. But think of it as having someone reminding and guiding you while you're executing your task. Again, this will reduce some of your stress load because you don't have to memorize, or sometimes you're caught in a situation where you just can't recall certain knowledge. So this will help you a lot. So this is where the AR and VR aspects comes in. Wearable technology, so health trackers, and for patients, wearable devices as well. We have implemented quite a fair bit of this in Singapore for the general population. Key in point would be the Healthy Steps Challenge, where we also incentivize people for exercising. So this is really a psychological technique where we just try to start to get the ball rolling. And of course, artificial intelligence and robots. We would definitely be seeing robotic caregivers in the near future, but I would imagine them to be in healthcare facilities like homes, nursing homes, or even home healthcare, where this would be extremely useful because it's unreasonable to expect nurses to make too much frequent house call. This will add on to their stress as well. So with that, I share my presentation, and I'm not sure if I'm supposed to take questions.
Yes, thank you so much, Dr. Adam. We truly enjoy your presentation, but because of time limitation, we are going to proceed to the next speaker. But we truly appreciate your time today and for sharing with us your extensive knowledge on this concept. Thank you,
Right.
Doctor, and have a good day.
Bye bye.
Bye-bye, Doctor. And now Amy will introduce our next speaker. Amy, please.